you kind of set this up for where you're going to start with it, Judy, or does he do it? Kind of tell you where to start?
I set the weights.
Okay,
Yeah.
so 59, I would probably start maybe around maybe 48, 45 or 50 maybe, and just test it, and then probably after a few cycles see how the pull feels, and then go up to 50 or so from there. Okay, I always start below. If it recommends 59, I'll usually start a little below that, and then
For
I'll raise
old
it.
ladies, I start them at 30. For most women, I start at 35, and for men, I typically start around 40.
Yeah,
Basically, I just start
Exactly.
low.
Exactly. And so then I set the table up. Usually I'll do 14 cycles. Okay.
Yeah.
That allows me to belt someone up in 3 minutes, take them off in 3 minutes, and then it gives me 24 minutes on the treatment. So the average, I'm putting someone new on every 30 minutes. Okay. All right. So I've got all the parameters in here. So what I do is I don't even sometimes say this if I know that the next person coming on the table, then I won't even save it. But you can save it if you want to, just so that you don't lose the information. So when someone's new, Cammie's here new. So, all right, Cammie, I'm going to go over this real briefly with you before you get on the table for your first treatment, okay? So I want to make sure I got everything spelled right for your name. Is that correct?
Yes, sir.
Okay, or if there's a problem, they're going to go ahead and tell me right now. I'm going to fix it. Okay. All right. Cool. Here in the comments, you'll see L4. That's the level in the lower back that doctor talked to you about. L4, L5. So we're going to put that number in here, and then we're going to use a 15-degree angle. So this table, you'll see this cable go up and down. Okay. So we can target different levels in your lower back based on these angles that we use and the weight that we use. So we're going to today start at a 20-degree angle, which is going to clear the stress lower in your spine, and then we'll maybe over time move up to that specific 15-degree angle at L4. But we're going to start lower. We find that it works better if we do it that way. Okay, so we'll watch you there, and then we'll make some changes as we go through the process. Where we start today isn't necessarily where we're going to end up. Okay. All right. Cool. So you'll see 15 degrees, and then we use a small belt to put around your waist. Okay. All right. So over here under the summary, under patient loading, you're going to see what your body weight is. 138. If you don't know it, you're going to plug it in right now. You're just asking, what's your body weight, Cammie? All right, cool. I'm going to put it in here. And so what you do is you'll make a slight adjustment here on the weight. So right now I have the maximum load set for the table at 45 and the minimum set at 22. Okay, so the maximum the machine will decompress today is 45 pounds. Okay, you should be really comfortable with that. Actually, some people barely feel that at all. If that's the case, then I'll go ahead and bring it up a little bit. It's not the amount of weight we use, it's finding the right weight for your body and your specific condition. Okay, so we'll be testing for that over the first several treatments. Okay, so where we start now isn't necessarily where we're going to end up. But there again, it's not about the weight, it's about finding the right weight to decompress your spine. Okay. All right, and 22 would be the minimum. So what's going to happen here when you're lying on the table is the table's going to pull up to about 45 pounds. It's going to stay there for 60 seconds. And then it's going to go down to what we call a relaxation phase, which is going to go down to 22 pounds for like 30. So it's going to go through these phases, okay? So it's not just like old traction. Old traction, like, you see on TV and all that, they just pull you from one end to the other. It never lets up, so it never relaxes. So it doesn't fully decompress the disc. These tables are the best technology you can get for spinal decompression. And so they're very smart. They have motors inside here which actually control the amount of poundage it pulls at. So if it notices that your body's tensing up on the table for whatever reason, because there's tender muscles down there and stuff, it'll actually back off. Once it feels your body relax, it'll begin pulling again. Okay, so these tables are very sophisticated in that process. So just there again, 45 is going to be the max, 22 would be the minimum on this. Okay. All right, so I'm going to go ahead and save this, and then we'll come back in here and find you.
It's pain.